I think that what the Jonas program has provided is a really revolutionary new way of taking care of patients, because having two attendings, one that's medical and one that's psychiatric, provides the ability to tackle both problems and really understand how they're interrelated. And so really the Jonas program has provided a new paradigm for taking care of some of the most difficult patients that the hospital has to take care of.
Some of the psychiatric issues that our patients are dealing with really need to be treated, need to be understood, how they're integrated into all of the problems that the patient's having. And getting a better understanding of how to manage these issues, I think, enhance my overall ability as a physician to care for these patients.
Recently I got to work with our psychiatric hospitalist on service. From start to finish, this is something that it was incredible. We would present our cases to her from the start. Patients who otherwise may not have had psychiatric input from the beginning of their hospitalization would see a psychiatrist, which allowed us to actually provide psychiatric help and care for patients who otherwise might have slipped through the system.
I see the patients regardless of whether anyone thinks they need to see a psychiatrist. I make that judgment myself, and I think I identify a lot more psychiatric issues that then would have been detected if it had been left up to the primary doctors.
There has been a noticeable decrease in the need for one-to-one watch for patients who are deemed suicidal and elopement risk.
Hospitalist unit we dealt with so many behaviors and a lot of psychiatric issues, so having a psychiatrist in-house helped us a lot in terms of expediting things and directing the care to her, especially with the one with the behaviors.
Seven Garden South has like 50% of our patients have behavioral issues, so her presence really helped in our discharge and transfers of our behavioral patients to the specific facilities in a timely manner.
Personally, to me, I think this should be the new paradigm in how we co-manage patients of this type who have active medical issues, or sometimes not so active, but more importantly, active psychiatric issues. And having a psychiatrist there on the spot, seeing the patient in real time, along with me and the rest of the house staff team, is just invaluable, and it's made a totally different experience for me.
It's important that a psychiatrist round with the hospitalist team because so many patients have comorbid psychiatric disorders. And it's important to identify those disorders for two reasons. One, it improves the care of the medical problems, and two, it relieves suffering.
And really what the Jonas program does, it helps a very neglected group, a very neglected population that the hospital serves. And so I really think it fills a void that's been missing here. And it's just doing really tremendous work for a group of patients that have very few advocates.